took a few months hiding.
We're trying to find Perry's. Is Perry, you familiar with them?
The steakhouse.
Right here.
Oh, I thought you were talking about a nurse, and I was like, I don't think so, but,
Well, I've been thinking it's gonna take me forever. I've had COVID and pneumonia in both lungs since I was here last.
and
And
now
I
a steak
thought I was
sounds good.
already at rock bottom.
Oh,
That girl said today, you're doing real good now. It's one opinion versus another. You're
yeah.
real good, getting closer this way.
I saw you wrote that on your questions to ask the doctor, so we'll make sure she addresses.
Well, yeah, Diane had asked them to do something. Well,
I've got
Diane
more.
said I was supposed to still been doing, the rehab. And I said, all right, they run out and said, well, today or tomorrow's your last day, or maybe was the last day. And I said, well, I didn't know. And they said, well, yeah, that's what they said. If they want more, they'll let us know, or let you know, so. I
Okay,
just thought evidently I was supposed to be doing it the whole time.
okay,
But I didn't get anything from the rehab till they just called. And they were
Okay.
just set for, I guess, 30 days.
okey doke.
Okay. Wow, do you realize your shirt or blouse matches that screen?
It does very closely, doesn't
It
it?
does, it really close, yeah.
Keep you on your toes. You don't know who you're looking
Yeah.
at, me or the computer. I am just gonna go over your medications, make sure they're up to date in the computer, and then Dr. McGetto will come in, but I'll make sure we ask about.
Is she over her? Somebody said she'd been real ill. Dr. McGee over her.
I don't know. I knew she was sick. I don't know exactly how sick or any particulars.
Well, they did some tests on me the 29th of November. And we were supposed to come back here early January, and we didn't, I guess, for whatever reason. That's what I was trying to find out. And whoever was telling me said, well, they finally got it, and it has 2 abnormalities. We didn't even know what those are.
Okay. I don't have all the information, but I'm happy to make sure she knows that you want it. So it says you're allergic to penicillins and dicyclomine. Is that correct?
I don't know what is dicyclomine.
It says it causes hives and rash and started in 2010.
Well, I have a lot of rashes and all, but Bentyl
Uh-huh.
I'm allergic to that.
That's the other name for it. I just didn't know which one you would know, but yep,
Is that the same as the other?
yes, sir. And
Okay,
then
well,
what about
it's-
penicillin?
Well, they did that 50 plus years ago. The doctor gave me some, I was having colitis, and then I broke out. I mean, I couldn't wear anything but a sheet over me. It would just look like leprosy, wasn't it? It was that bad. And then when it healed, an old nurse in there, and they Clancy, hon, you look like you're gonna live. I thought I'd already died. It was so bad.
Wow.
It went away.
Now here's an interesting one. It says Benadryl. Are you allergic to Benadryl?
Mm-mm.
Okay.
But I'm allergic to a whole lot of things that Benadryl helps with.
Well, that makes sense.
Yeah.
Okay, it says your preferred pharmacy is the Dorado Pharmacy in Odessa
Mm-hmm.
on Fadri Road. Am I saying that right? Okay. It says you're taking out Buterol inhaler as needed for wheezing.
Yeah, I mean, I think, I'm not sure my hearing aids are kicking in.
I can speak up too if you need.
If they're gonna work. Yeah.
Allopurinol.
Uh,
Okay, I'll just speak louder.
Allopurinol.
Yeah, I know my
And
voice doesn't hear you.
metoprolol I take, and also,
Well, there's a long list, so I'm gonna read them off and you tell me yes or no, okay?
okay,
Allopurinol, 100 milligrams daily.
mm-hmm.
Vitamin C, 100 milligrams
I'm
daily.
taking 1,000 with rose hips of vitamin C. But that varies, I could change it. I mean,
It's just what you get over the counter, is what
Yeah.
you're saying? Okay. B complex vitamin daily. B complex vitamin.
well, I use a lot. I used to use one, but I take zinc and vitamin B complex and vitamin B12 and a whole bunch. I
Okay.
mean, I ought to be the $50 million man, but I ain't.
What about Pulmicort? Do you take Pulmicort?
I have, but I
Budesonide
don't
the other
think I
night.
have
It's a
now.
nebulizer. You don't take it?
Mm.
Okay.
What is it? What is another name for that?
Budesonide or Pulmicort?
Oh, I take budesonide every day.
Okay.
I've been, on this, I've been using budesonide for the last probably 3 weeks and Buterol,
Mhm.
bromine, alternating them twice a day.
Okay,
So that's 4, what do you call them, breath treatments,
yes, sir.
4 a day with the variants.
Okay,
That's what the doctor wanted me to do there, because we're trying to get over COVID and pneumonia, but, you know, I just don't know golly, I haven't spit anything up. I said, why ain't y'all keep having me drink this water, do all this stuff, just wait till next week? And we used to, like, we had cold.
mm-hmm,
Yeah, it's something that changed. Boy, you sound terrible. I know, but I feel better, I'm getting over it.
mm-hmm,
That not happened. It's just like, I don't know what it is. I could hardly take the breathing test, cause when I breathe like, it won't quit cough.
mm-hmm.
And when I breathe out, won't cough. Her test would have been simple, except when I breathe in fast enough and breathe down fast, they're like, well, who in the world would come
Lordy,
kicking
who
in?
is this?
How you doing?
Did you just come in here to cause me stress?
No, I just come here to get my last wishes in before I die. Whatever that is. I'm trying to figure what all I got
Okay, the
wrong.
last time I looked, I don't wear a collar with the little black things. I don't do last
I
rights.
know you do.
You got the wrong office.
Yeah.
All right,
Thank you, ma'am.
Yeah,
you in here holding court.
I know. If I guess what I've got just never gonna get better, is it?
No, sir.
About a month ago, they were saying that Bubba said, Dad, you don't know how sick you are. And I don't know, but I was getting down in the oxygen all because I had COVID. I was just getting over it, just said, and I didn't know I had COVID. And I had pneumonia in both lungs.
When did you get COVID?
I'd have to check the date. I'd say 5 weeks ago.
So you didn't call me so we could get some Paxlovid going for you.
Well, I'll
Keep
give
you out
my
of the
doctor
hospital.
your number to be calling.
Your doctor didn't call me.
Yeah. I think it's what I keep telling them. They're treating like pneumonia COVID. It's kind of like my leg. They said when I'm worried about my legs. I've got to worry so I don't have to have surgery on them. I can't start doing this and just totally neglect that. Y'all need to concentrate on all of them. So
You mean we need to see you as a whole person and not pieces of the person?
that's what seems,
Well, I'm with you on that one.
yeah.
Okay, hang tight. Let me get in here for a second. I saw you back in November.
They took
So-
blood. They took some drops of blood the end of November.
Yep.
I called in early January because I hadn't heard anything, and you were sick, I think, about that time or whatever. But anyway, they didn't have the results of the test, and it had been a month.
Yeah.
So a
was
day or
that-
two later, they called and said, "We do have the result, and it showed 2 abnormalities. Dr. Megiddo will get with you." That's probably when they were setting this up, more than likely. I don't know what they meant, 2 abnormalities. I may be one just by myself, and whatever else is added to it. So crazy.
I can always count on you saying something out there.
Yeah.
Okay.
10-4.
All right. So let's back up this conversation for a minute.
Okay.
So I saw you last at the end of November, it's like right after Thanksgiving, somewhere in that ballpark.
Right.
So
Yeah.
you said you got COVID when?
I don't remember the day, but about 5 weeks ago. Wasn't
Okay.
it? I can find out.
What were your symptoms when you got COVID?
Well, I had, I don't remember what they were. They took me over to Amy. I was having trouble with my oxygen, and I wasn't getting around doing it, and I was on the oxygen machine, the oxygen condenser, and, but they took me over there to that clinic, and they ran check on my lungs and said, you're at the end of COVID. What she didn't tell me a test, said you're at the end of COVID and you've got pneumonia in both lungs, all the way full in your left lung, halfway in your right lung. And I would not let them put me in the hospital. I was out there, that's almost a death sentence. So we went home and we buckled down and did, and I started taking budesonide and then first that's what I was taking, then I was taking albuterol, bromine or something, alternating every 2 or 3 hours, and then we cut back about 2 weeks ago, we were doing it twice a day. Do a budesonide in about 3 to 4 hours. That varied the day. We tried to hold that schedule. Do budesonide, then albuterol, then later budesonide. She said 4 days. So that's what I
So did y'all lose phone power, cell tower out there?
We got everything except somebody willing to call, I guess. Yeah.
But I didn't get a call to say you were
But I don't
sick.
have, yeah, another thing, my nurse changed. I didn't try to get her. I talked to another nurse, but,
Cause we
Nana
could've
and
fixed
was
that from out here, I could've got you on some stuff that would've turned this around pretty quick.
Good.
But I didn't get a phone call to tell me that you were sick, so there's no way I knew you had COVID.
Well, I've gotta find out why that didn't happen. 'Cause it
Yeah, I'd
really-
like to know too.
Yeah.
Cause, my nurses know, they don't even have to check with me. If you called in with a diagnosis of COVID, we're treating it. We would've had you started, they don't even have to ask me, they have a standing order. My patients call with COVID, they start getting treated. They don't have to wait to find me. They call it in right away.
Well,
They-
the thing is, when they figured I had COVID, it
Yeah.
looked like I was right at the end of it.
I don't know what that means, I'm gonna be honest with
I
you,
don't-
as long as I'm concerned, if you're positive, you're positive. I don't know what I
Well,
don't even
The
know what that
doctor
means.
originally, about a year ago, when my wife got COVID, she felt terrible.
Yeah,
No temperature, no bad oxygen, but she felt terrible 4 days. She said, I gotta go get checked. Well, Mita, where you hurt? I don't hurt. I just feel worse than I've ever felt.
Yep.
So we took her down, tested her. She has full-blown COVID. So he said, we need to check you. I said, well, I feel perfectly normal. We checked and I had COVID.
Yep.
So I guess it just affects people different ways.
oh yeah, it does. Some people just have like a cold, they don't feel bad at all. Some people don't feel it. Some people get up in bed for a couple days with fever. Some people are in the hospital. Some people get horrible chest pain. Everybody's a little
Yeah.
bit different. We just can't. Some people are so sick they gotta go in the ICU on a breathing machine because.
Should I still be doing these,
and
stuff at the gymnasium and all? See, they did, I would've mind, and they said, well, tomorrow, or I can't remember, like, tomorrow's your last day, and a couple of days, and then, well, it's been good. I said, well, is this what I'm doing? I didn't know what I was doing, they had orders, and so I was pumping on bikes and doing stuff, wasn't doing anything straight to my lungs, and they said, yeah, that's what we had an order for. They said if you were supposed to do any more, somebody'd be calling you. Well, then they told me a day or two ago, sounded like you might have been supposed to have been doing them the whole time. And I said, well, my orders were to come from them, and I don't know where they got
do what the whole time? The rehab?
the rehab.
Yeah, you were. You mean while you were sick? No, not while you had
But
COVID.
I mean, from the time I was here,
Yeah.
they just said I had this much and then that was it. We got problems there too.
Huh.
Yeah,
So tell me how you feel right now.
I just feel pretty well, pretty fatigued. Not bad as when I had H. pylori, but pretty fatigued, and I can't walk very far without oxygen. At the house, I'll take the steady one that gives 6 liters. I stay on it mostly. I get off and get on this one, and it's all I can do to try to keep it in the 80. This portable one, it's a pulse type, and so I haven't been carrying straight oxygen, but I got a couple of bottles like this.
This one needs to be retired.
You think it's not good enough when it was new, or?
No, you need more than that can deliver. So today you needed 4 liters continuous,
Yeah,
which isn't bad, but it's still worse than you did for me back in November. But you also had COVID since November. So when you were here last time, this was probably okay. But as of right now, because it's pulse, it isn't gonna deliver what you need, which is why when you use it, you're probably dropping pretty low.
well, Mark was telling me something I didn't know. He said that thing coordinates with your mouth and knows when you start to take a breath. Well, in my nose and with all I've had, it's hard for me to know. And he said, Dad, you almost have to learn to get syncopated with that thing, and then it work well.
That is
While you're doing
correct.
it.
That is correct, but right now, this is, what's the max this goes to? What do you put it at when you
I've
pump
got
it?
him 5 now.
That's probably the max, as he's under about 5. So, 5 liters on this is probably equivalent of 2 to 3 liters on the continuous flow. So it's just not delivering what we need. Now, the $1 million question is for me, you said COVID was about 5 weeks ago.
I'm guessing I can,
So what I don't know is whether I'm looking at a temporary drop because of COVID. So COVID does a couple things. It can come in, you get pneumonia. So when she said you had COVID pneumonia, I don't know what they're looking at, because I don't know if you really
one
had.
thing, she looked at x-rays.
Right, but what I'm gonna explain is, what sometimes people look at x-rays of patients with pulmonary fibrosis and they call it all pneumonia. And they don't know to differentiate between the two. So we would look at your most recent one, your old one, see what changed, what stayed the same. So if nothing changed, I'm not calling it pneumonia, but if it's clearly different, then yeah, I would probably call it. So without seeing that, I can't say, but I can say that I can see why you're more tired and your oxygen's up, because you definitely needed more than you did for me back in November. This is a definite change.
Let me say one thing, what you're talking about, can't tell the difference. That's what I said, is like y'all are treating me for COVID pneumonia without regard for the pulmonary fibrosis. And she kept saying, well, you need to drink more water. Drink 5 bottles and 6. So I'm doing a ton of drinking water and taking these breaks. And I said, but I'm not spitting anything out. Well, you will next week, and then next week. Well, I've never spit anything out. I mean, she said the other day, well, it sounds like your lungs are about 60% cleared. And I said, well, what little of lung I have maybe, but why would they get cleared if I hadn't spit anything out? I mean, I'm
So
coughing.
your lungs are never gonna be clear.
They're gonna want it.
Never gonna be clear. So
This-
here's why. So you have pulmonary fibrosis, which is the scar tissue we talked about. That does not go away. So when I listen to your lungs, the sound I hear is like Rice Krispies or crackles or, like Velcro. If you open up a Velcro tab, you get that little crackle. That's what I hear. That's not going away. What I'm listening for on top of that is if you have wheezing or other things that shows me you have inflammation on top of the fibrosis that we could potentially reverse. So when I look at your numbers today from November, they have actually taken a bit of a hit. They're definitely lower than they were back then. So probably, yeah, you probably did have COVID pneumonia. The $1 million question is there any reversibility here? And that's what we're gonna do. So let me take a listen. Because you really sort of didn't, it doesn't sound like anybody gave you the standard drugs that we normally give to get you over these quickly. Because there's 2 drugs available. One is called Paxlovid, you take for 5 days. Have you ever heard of Tamiflu, like when you get the flu? So the Paxlovid is the same type of drug as Tamiflu. It sort of shuts down the virus quickly so that it doesn't last as long and doesn't cause as much damage. Same concept of how it works. The other drug is a drug called Remdesivir that we would give IV if you had to be in the hospital for any reason. That's a lot stronger, but that's usually for people who have COVID pneumonia with low oxygen, which you didn't want to go in the hospital, which I get.
Well,
But,
I'm
I
not real
could have gotten you.
in favor of
Go on.
remdesivir either.
Huh?
Yeah, I'm not much in favor of remdesivir.
And then, so we could have just done Paxlovid at home, which would have been a 5-day set of pills, just like Tamiflu. And I probably would have done that plus or minus some steroids because you would had pneumonia with the oxygen level, which my goal would be in that setting to minimize any damage, because COVID pneumonia on the lung can make fibrosis worse in some instances, and some people who never had fibrosis actually get fibrosis after having COVID pneumonia.
Well,
Again, it's one of those things, I can't predict who's gonna do what, because like we just talked about earlier, people have a range from no symptoms at all from COVID to the other extreme where they're in the ICU.
There's never any explanation here as to how I got
The fibrosis?
fibrosis or COPD, and you told me.
Well, you
before.
smoked, didn't you?
No, very not.
Oh, hang on.
Mother
COPD.
mother and dad did.
Well, yeah, that's part of it. Give me a minute. There is something with smoking piece in it.
I've been around sour gas before. In fact, 1962, they brought me down here to Baylor Hospital, thinking they were going to have to do a brain, take out a brain tumor. And Dr. Albert Dorico checked me out and said, said you had severe migraines, 2 of them. Put me in the hospital, had to knock me out. And they've both been caused by things getting in my lung. One was sour gas, which it didn't overcome me, but it must have been enough to affect. Another thing, me had just painted most of the inside of the house, and I slept there that night, breathing those fumes. So both of those, though they thought I had a brain tumor, they were affiliated with my lungs. And we didn't know what there was back then. 62 was what, 60 years ago?
Long time.
Yeah. 60 years. Albert Dorico he saved a lot of lives. Kings and queens come here to get Dorico. And here I'm a 22-year-old nobody, and I've got Dr. Dorico. One of the guys in there, he's in there with, you can tell he's just mad. Walk through an iron, Dr. Dorico. Sometimes it's kind of like a drop. Robert Wright, my doctor, went to Baylor, and he trained some under Dr. Dorico. That's the reason. Wasn't what you know, it's who you know. In that case, and a lot of times, it's the case.
All right, young man, let's talk. So 2 things. So your COPD or your emphysema was probably something you were exposed to. Could have been a combination of when you were born and something, not when you were born, but your exposure growing up. Could have been exposure along life and maybe a combination of your genes. No control over that. The good thing is if you're no longer exposed, it's not going to keep getting worse. The pulmonary fibrosis, I think you probably have IPF or idiopathic pulmonary fibrosis, meaning all the testing I did looking for a cause was negative, which then means by definition you have what's known as IPF or idiopathic pulmonary fibrosis, which we typically will see in people over 60, men usually more than women. No predictors. Usually it's thought to be believed a combination of your genetics and some exposure. Nobody knows what that exposure is at this point in time. It isn't something that's reversible. It tends to march. There are medicines we have available that will slow the rate of scar. Nothing reverses it. Now there are several ongoing clinical trials that are open with drugs that may or may not potentially reverse it. Those are optional, but you're pretty far away, so that makes it harder for you. Certainly, if you're interested, we can do it.
You know, mentioning that, doctor, that Trelegy I was taking,
Yes.
when I got this other, she doubled that to double dose of Trelegy. Not 2 of them, but twice. Went from
The
100
strength to
From
200.
100 to 200 or something like that.
Yep, exactly.
But if she hadn't contacted you, you wouldn't know that. So I need to,
Okay, so they doubled your Trelegy strength.
yeah, I don't know how long it was like a temporary deal to get over it, but it may not be a temporary deal.
Okay. How's the cough?
How's the what?
Cough.
Cough.
Oh, it racks me down from the one end to the other, solid, hard. And when I get to lay down coughing, that it's not incessant forever. I'll get it when I start doing breath treatments usually. After I did the breath treatments, a few times it'd feel like something was gonna come loose. Not in a big way, but little. And I'd say over 2 weeks, I probably fit up 8 or 10 times, about a teaspoon or something. It was like whitish clear, period. Wasn't any color in it. Well, she said it showed to not be, it was viral and not the other, because if you turn, and she gave me some pills, like 750 milligram, some, yeah, she said.
That's
sure.
antibiotic.
Yeah,
Okay.
I can go back and find.
No,
what that
it's,
was.
levofloxacin.
Yeah,
It's
probably.
750. All right, so they treated you with antibiotics.
I haven't been on that for probably at least a week.
Yeah, that's once a day, okay. Okay,
But it looks to me like, in a manner of speaking, is if you got something like this, everything else can affect your lifespan, because everything can be affected. It can be affected by other things or affect them. And I'm not sure a lot of these doctors seem to know that. They treat one end and don't look at the other end. Not to the exclusion, but it's pretty bad. That's kind of like when I said on my legs, I just said, well, wait a minute. I mean, we need to call Dr. Copeland now. I said, he said he would see me after 6 months. It's been about 3 months and to try to watch it and not get it so bad. But it doesn't mean I ignore it. And I start doing stuff that may be detrimental to my legs. I don't want to have those veins all plugged off and all. And I talked to a guy this week. He had new veins run from his legs all the way up. He's still there. They got the swelling down.
yeah,
It's very inconvenient.
so this would have to be a coordinated effort with, is he wanting to put stents in there? Or surgery?
I went to see him because of the coloration and all. He said, he checked it and said, you've got 2 veins in the right leg and 3 in the left one. And I said, well, what stops them up? He said, they don't stop up. As you get older and your legs weaker and all, the valves that are in those veins to help your blood come back up just quit working. They just kind of like sag apart. So the blood goes up and back down, up and down. And the ones beside it are pumping it like they're supposed. Well, the blood is going up and down, is keeping that much circulation. So what we go in is, we used to do surgery and replace them. Now what we do is go in and we stop them up. Takes those out of contention anymore. If you needed them for like surgery, bypass surgery, you don't have them anymore. But that's the way they do. They stop them. It's not a matter of your blood vessels stopping up, a matter of they're open. Now,
Yeah,
it's-
everything just, the
Of
valves
course,
don't work anymore.
I
Yeah.
guess if they got long enough and set there under the right conditions, they could create clots in them. What normally happens is you get this edema or something and it starts affecting, ulcerating your skin and all, and then they have to go do something. But
Well,
that's-
is that what we have going on now?
Well,
Nope, he's good.
but I had them, my legs were swelling more, especially the left one. That's the reason when she was saying use more diuretics and all. I said, my body's trying to figure,
Can we not do more diuretics? We need more diuretics. Let me
I
look
can
at
do
something.
more.
No, those legs are good.
But
I'm not trying to dehydrate you. Let me look at something.
what I've been doing is taking 25 milligrams of HCTZ every day, along with a half of an 80 milligram telmisartan. For years, I took a different blood pressure medicine, and the diuretic was built in it. Then they quit covering it with insurance, went to $250 a month for telmisartan, for Micardis. I said, well, what else? Well, telmisartan would do what Micardis did. We just had to take the HCTZ separately.
Yeah.
We've done that for 8 or 10 years and it's worked well. But with all this checking this stuff for my blood pressure and the diuretics and the stuff doing my lungs and all. It started throwing other stuff out of kilter. Whole thing was drink more water, you can't drink enough water, and take these Lasix. I started taking, I think 50 milligram Lasix, I believe. Lasix, they said, was best for knocking water out of lungs.
So here's the problem. This is where we have to be real careful. People look at your x-ray and they assume it's fluid or pneumonia. It's not.
Something
It's
else.
fibrosis. It's scar. So treating the wrong thing can get you into trouble.
I agree.
Which is why if you have any breathing or lung problems that are getting worse, I need a phone call to my nurse. Because this happens a lot in places where people don't get this disease. They don't get how it affects the rest. The other thing you have going on is your esophagus doesn't work very well either, which makes me concerned that when you eat stuff, there's the potential for it to go back in those lungs. Cause you mentioned in passing there that lying down and coughing is an issue.
Well, another thing, if I'm taking something like eating bread that crumbles, like dry bread or cookies or something,
Get
a
stuck.
lot of times, if I breathe it all while I'm eating, it tries to go in my lungs.
Well, that's so your esophagus is a muscle that squeezes like this down. Yours kind of just sits here, it gets kind of narrow in places, it just kind of is on vacation right now. So that's why I wanted you to get
They're
seen.
doing that in the morning.
They're gonna see you? What are they gonna do, a scope?
They're gonna do the scope at the Johnson Hospital. I don't know if they do the rest. Then my daughter-in-law's had that twice, and she sent me a thing about hers. It's where these mucus rings form in there, and they tend to dry up and shrink.
Well, they
And
dilate them, but these guys are the best at what they do. This is all they do, thousands of cases a year, so they're good at it. So I want to see if there's anything we can do. So here's why I worry about this and why it's important. Your esophagus, when you swallow food, sits right next to your breathing tube, which goes this way, right? So the openings are literally next door. So you can imagine if you're lying down and there's any food or liquid in there, it's easy enough for it to come up and a little of it slip over. Now you have vocal cords that cover the opening to your breathing tube. Those vocal cords don't like acid. They don't like stuff coming up from the stomach. So if anything hits them, you start coughing because they're doing their job. They're saying, not in here. You're not supposed to be here. So you start coughing to make sure anything does not get down there. Sometimes if it does, it can make fibrosis worse because it gets all irritated and inflamed, and that's it. Let me sort of go back on a little bit of how that fibrosis occurs. So normally we breathe in whatever's in the air, right? So it could be dust, could be chemicals, it could be nice clean air, who knows? Stuff gets down there and the lungs' normal response is it either is going to cough it out, or if it gets too far down where you can't cough it, it's going to send in the army to surround whatever it is they got down there, and it's going to basically go to war, and it ends up kind of getting it all encapsulated in this nice little area. What normally happens, it does that, then it scars up a little bit to prevent it from going anywhere, and then the scar eventually dissolves and life goes on. When you have fibrosis, it gets to that part, it gets to the scar part, and it's like those old 45s, if you got a scratch in them and you get to, keep saying the word or a piece of that song, that's what happens. And it just keeps making more scar. It's a glitch. And for some reason, it doesn't keep going to the natural process where the scar is supposed to resolve and everything goes back to normal. What nobody knows is why we have that glitch. Why does that happen to some people and not to others? So it happens, for some people it's a family thing, for some people it just sort of happens because of something they're exposed to. So I told you last time that we think about medicines. You're not on any medicines that cause this. Your lab work for any mold or bird exposure, that's all negative. Any autoimmune disease, we talked a little bit about how things like rheumatoid arthritis and any other autoimmune disease could cause lung disease like this. That's all negative. So this is where I go into the idiopathic pulmonary fibrosis pathway. for you, I would seriously consider two things today. One is, I know we sent you some home with some information on, the two medicines we could use to slow it down. And then today, listening to you about COVID, I'm gonna get an x-ray and listen to you, but I probably would do a short course of prednisone to see if there's any residual inflammation we can sort of kick to the curb and get it out of here. And see if I can get a boost back to where you were in November, or at least closer to where you were in November. Cause you did take a hit, and it's probably from COVID. But I think we might, sometimes with steroids, we can get a boost back up. So I wanna do that. So that's where I'm thinking. Did you think about those two medicines at all?
Well, at first, but then I got into all this, I haven't hardly thought of anything. I'm not doing stuff at the office. It's like, I get through it, and I said, well, it's another day.
You're
And
tired.
I'm doing all this, I'm tired to give out. I'm even sick of them old TV programs, I don't wanna watch them, but by the time you do this, you gotta start taking another one of these medicines, you gotta.
Okay, so the
Yeah.
treatments, let's ask this question. Do the treatments actually help?
The treatments that.
The breathing treatments, do they make you feel better, or you just do them?
Well, right now, I don't know if they're helping.
So then don't do them.
I can't tell.
Yeah.
It looked like at first there was a little response. It doesn't seem like they're doing anything. Mark asked me, my oldest son said, Dad, why are you drinking all that water? And I said, well, they said drink the water and take the diuretics in the water. And he said, it took me 3 months to get over COVID, and I didn't drink all that water. Jeremy said, you don't drink all that water. Most of the water he gets is from several cups of coffee a day. And so.
That's not water, but okay.
It's made with water.
Well,
Okay, I'm gonna give you that, but it's getting rid of the water that you put in there, so,
Yeah,
because
big boy.
it's a diuretic.
Well, I drank quite a bit of tea,
Okay,
and they told me you can't count tea. Well, I read Maya.
so we're giving, so here's what, so you're basically battling yourself, right? Because
A lot.
they're telling you, drink all this water, but then take this pill to get rid of all this water, so you gotta pick one, it's either one or the other.
Yeah.
I'm sort
That's
of,
what
I
confused
actually,
me.
okay, I'm not gonna call coffee your liquid for the day,
Yeah.
but it is, 8 glasses of water a day is about normal. And you're taking a diuretic already, so
8
frankly,
to
I
8 is
don't need to torture
64.
yourself. Yeah,
8 to 8 is 64, and that's what, 4, let's see, those are 16.9, so 2 of them, 2.5 would be 2.5, 5 would be 2.5 quarts. 64.
you can get water toxicity, so don't overdo the water, just
You
drink
don't have
it.
to worry about them overdoing the water.
I
8
thought-
glasses a day is not normal for them. Maybe
But
one.
I used to
Oh,
drink.
okay, we're good then,
But when I was
we're
growing,
good then.
I drank a lot of water, but I was doing things to pass water. And it's
So what are you drinking if you're not drinking water?
mostly tea.
Iced tea?
And I drink some water
Unsweetened?
too, but tea, I keep tea in there by my chair. In the morning when I go in there to do breakfast, I'll fix a cup of coffee and then.
You that person that keeps a gallon of tea in the fridge all day long and then replace
do.
it every time the gallon is done? Yeah, I know somebody who does that.
I've got a bowl that I cook 2 gallon things in there.
Yeah.
And put the saccharin with it, which we've done for years. And I get it hot, pour this hot water over it, let it set, stir it up, let it set till it cool. I squeeze all that out of those bags to make sure I've got
Yeah.
what I have in there to make it for 2 gallons. And I got a couple of bottles like this. I pour each the same amount. If I don't, I'll equalize it, then fill them up with water. Each one makes a gallon. I usually do that right after I've just made a gallon. So it's usually pretty close to 3 gallons available. And I imagine I drink at least 2 a day.
So maybe if we could do those 16 ounce bottles, maybe if you got down 3 of those a day, that'd be fine.
Well, I was drinking 5 a day, plus the tea.
Well, 5 a day plus the tea plus the diuretic. Okay, that's a lot. So
Yeah.
I'm gonna say, so let's talk about what drug. Let me ask you this before I make a recommendation. if you, so the OFEV, which is the drug that is twice a day, biggest side effect of this drug is diarrhea. Does everybody get it? No.
I've had some recently, not terrible,
Yeah.
real loosey-goose school, but not diarrhea. And that kind of comes and goes. I figured it had to do with maybe the pills or something.
That could have been from some of the meds. The question is, and why I sometimes hesitate, if I have somebody on a walker or somebody who would have to get to the bathroom quickly, I don't want to increase the risk of falling and having an injury. So sometimes I recommend the other one, which is the Esbriet, that is 3 times a day. And usually starts at a low dose and we build it up.
The
Okay?
doctor, I was raised slave to my gallbladder. And he tried to take it out when I was 15, and I wouldn't let him because he was taking everything out of everybody.
Yeah.
He's just an army doctor, good guy. But you go in there, look at your tonsil, take out your hemorrhoid, something. I said, you not take them. He said I had a bino.
Okay, we're not doing any, no surgery from this person right here.
I'm just saying.
All I'm gonna do is the meds.
But going to the bathroom, back when I dated me and all, that thing was slave. Just be fine like sitting here, I do the bathroom.
Well, how do you feel about that?
Well, it's not so bad if I'm around home. I may not be anywhere else.
Well, so, and then not everybody has diarrhea. Some people, I have people who take this medication and don't have any side effects. So it's
Would
not
there
everybody who
sometime
has it.
one medication work better than the other one? Where I could try one a couple of weeks and then try the other one?
So, does one work better than the other? Short answer is probably not, as far as we are aware. Nobody's ever done a head-to-head comparison. They both do the same thing though. What I usually do, I start with one. If you tolerate it and things are good, we stay on it. If you don't tolerate it or you have bad side effects and it's just making your life miserable, we go off of it and we switch to the other one.
Now, you know whichever one is the cheapest, I'm gonna be partial to. People don't work
Then
into it.
I'm going to tell you up front, if you want to go with the cheapest one, you got to go with Esbriet, the 3 times a day, because that's gone generic. The other one is not generic. So the average yearly cost of OFEV, if you had to pay out of pocket, is upwards of 90 to 100K out of pocket. The Esbriet, which is now generic, they both were about the same price, but the Esbriet, the most
90 to 100K per year.
per year.
That's out of pocket with no insurance.
That's with no insurance. That's without Medicare or anybody paying anything for it.
Oh, wow.
It is FDA approved, so
You know
usually we
what,
get some
Trilogy?
coverage.
Trilogy, $629 for 30 pills. I said, I'm having to get used to $21. $21. That's, I don't know why they don't actually, okay?
You're the first person
you
who's
could've
come
gone
here
there.
and
You could've gone there.
and divided it up per day inhalation. That's $20.
You know, if you just
I
gone
got it per
your
breath.
whole life.
So
Yeah.
that's your dinner out each day. It's
Okay.
just one puff. Okay, gotcha.
Well,
Let's do this. If you want, I mean, you sort of made a decision if you said to me, I want to go with the cheapest one. Because then I would go with Esbriet because it's going to be the cheaper of the two.
and you think it'll work as well.
They both work the same.
Okay.
There's nothing, so when I say it works as well or not as well, it's also a matter of how well you tolerate the drug and the
Right.
side effects. Because I have some people who can't take either. We've tried both. And the side effects are such that they are just so miserable. As far as I'm concerned, the quality of life is also
Does it
important.
give them more oxygen? How does it improve their quality of life?
No, I said it can worsen their quality of life from the side effects.
In other words,
So when you have this disease, I'm not looking for things to get all better. I'm looking for things to hold the fort steady.
okay,
So if I get any upward mobility, that's icing.
okay.
The goal is to keep level and not go down. That's the goal at this point.
So,
Now, if I am going to put you on a little bit of a prednisone taper because of the COVID pneumonia, we might get a little boost here. That's my hope. But I'm not looking to say, hey, you're going to go back to being out in the field all day and not needing any oxygen, I would be lying if I said that to you, and I'm
Seems
not
like I'll
going
be
to.
carrying oxygen the rest of my life.
You may, like I said, if you get a boost from the pneumonia and the prednisone and the COVID pneumonia sort of still hanging around, you might get away with going back on this thing. But while we need 4 liters, I would suggest we get you a smaller version of this.
Okay.
So what I've had some people do, it depends on the distance you're gonna walk. So if they're gonna do a short distance, they might use this thing. But if they're gonna be walking any major distances, then you're gonna need that thing. That's the difference. So if if you're
How
gonna
long
do 20
will
feet,
that last?
depends on how much. So when you're sitting, when you came in, were you wearing oxygen today?
I was on that. This is belongs here.
So-
and they said it on 4.
Yeah, but when you checked your oxygen, when she checked your oxygen when you came in, you were wearing oxygen?
Yeah,
Okay.
Well, she turned it off before she checked it.
yeah. It's
Did she turn it off for a little bit
Good.
or just a minute?
It wasn't very long.
Okay,
I don't know
So-
the exact time frame.
we're gonna do a
So I
little
wasn't
test of
really-
our own here in a minute.
I wasn't counting. It was a couple minutes
I'll
at
just leave
most.
it on.
See
Well,
where it goes.
no, it might have been because they took. Were you wearing it when they took your, how tall you were?
We'll just let it sit for a few minutes and, what's it at right now?
Check how to fix it. 93.
When he was just sitting in the lobby, it was at 98.
But he was wearing oxygen.
Just like he is now, except he wasn't talking. Well, he was talking, but he wasn't.
Does he ever not talk?
He
Sometimes,
sleeps.
Yeah. I
But
do.
when he's not sleeping, he's talking.
But I started talking in sleep.
I don't know if I don't know what I would, I know we're in trouble if you stop talking, and I know we're really in big trouble.
Well,
Okay, hold tight. Let's just see what happens when you're not talking.
that's 91, so did you just shut
You
it
gotta
off?
give it, you gotta give it a minute or two. Cause it's not gonna, if it doesn't drop super fast, that's actually a good
Yeah.
sign. It's not dropping.
One bad thing about talking with this canoe up here is some of this is not going down your throat because you're
Breathing it out.
If you ever if you ever get really winded and you can't catch your breath, cause it's hard to do that, you can just pull those prongs down, breathe it
What I
from
did
there.
the other
It's going the
night.
same way.
I just, the one out of that one, I can put the two, I just pulled it in my mouth.
Yeah.
And I can kinda feel, and first thing you know, I'm sinking with that thing. Cause the air, I can tell it kinda, and you'll get to where you kinda get the rhythm with it,
The
so.
other one's way bigger than that. That you
But that other
laying
one,
there.
He has another
the other
one
one
like-
didn't.
This
at home.
it's
Didn't
within
do
their
that.
hotel room
It's
right
just
now.
steady oxygen.
Okay, yeah, it's continuous, it's not pulse, then it's fine.
Now I got in the car the other day and we were sitting, doing something and I said, oh boy, I gotta get this window down. That thing wasn't putting, my oxygen was low and I'm sitting there with it. What happened, you put it in a little confined space, it's taking oxygen out of the air. In a minute, the air it's already got, and you ain't got it. So you gotta be sure you're getting it.
Okay, I want you to stop talking for me now. I know it's hard, but I need you to stop talking for a minute. I need to see this, cause you're coughing more now that we turned off the oxygen, your cough picked up. You're still sitting at 93, which is pretty good. Cause when you walked, it did not go off. It's gonna flow.
Up to 91 and 90, 88.
Yeah, she had you at 95% on room air.
I'll read it for you. It's still at 89.
Perfect, let's see. See anything?
When I stay away from
88.
it goes down, but my pulse comes up. And for me to get this back up, I have to sit there and let my pulse starts dropping, then my body realizes. And it
Well,
can-
that's cause your pulse goes up because it realizes your oxygen level's low,
That's right.
so your heart's pumping faster to get more blood around the system. Alright,
How accurate
I
are
don't want
those?
you to touch, I don't want you to talk, I just wanted to sit, cause you did dip into the 80s on me there for a minute.
I guess since you're using that one, they're pretty accurate.
It's respectable, actually. There, keep it there, don't move and don't talk. Cause now I wanna do, hey, Angela, where's our post office?